Good afternoon, everybody, and welcome to the DC Office of Paid Family Leave panel discussion on the balancing act, work, family, and the role of paid family leave. I am Adriana Hopkins. I work with ABC 7 News, WJLA 24/7. You can watch me from 7 to 9 a.m. on WJLA 24/7 News and at noon on ABC 7. I am very excited to be part of this pre-activity for Mayor Muriel Bowser's upcoming National Maternal and Infant Health Summit. So since July 1st of this year, 2020, DC paid family leave benefits have been available to DC workers so they don't have to choose between caring for their loved ones or themselves or bonding with a new baby and their financial security. Very important. So DC paid family leave covers up to 8 weeks to bond with a new child, 6 weeks to take care of a family member with a serious health condition, and 2 weeks to take care of yourself for your own serious health condition. Now, paid family leave does cover 90% of your wage replacement, up to $1,000 for up to 8 weeks of the year. And for more information, very important to go to this website, dcpaidfamilyleave.dc.gov. So today we will be deep diving into the impact that paid family leave has on economic stability among women and families. And I have the pleasure of being joined by several ladies here, all acclaimed and very accomplished women. So Dr. Meredith Anderson is the Senior Research Associate for the United Negro College Fund. Dr. Jessica Lazarov is the attending pediatrician at Children's National Hospital. Dr. Unique Morris Hughes is the director of the DC Department of Employment Services. Amanda Rodriguez is a blogger and founder of The Dude Mom. Simona Noche Wright is the publicist and co-founder of District Motherhood. And Karen Lindsay Marshall is the director of advocacy and engagement for the National Alliance for Caregiving. So great to have you all with us here. Can't wait for you to share your expertise with us. So let's start by first asking our panelists to talk a little bit about what you all do, share some of that expertise, and the biggest challenges and changes that you've seen in families for this year. It's been a very difficult year with the pandemic going on and kids going to school virtually for the start of the school year. So Simona, let's start with you, with what you do, your expertise, and some challenges and changes that you've seen in families.
For sure. Well, I'm very excited to be here. Thanks for having me. I am Simona Noche Wright. I'm the co-founder of District Motherhood, which is the premier organization for millennial moms of color in the DMV area. One of the challenges that we've seen, that I have conversations with all my mom friends and just hearing from my DMV Mom Tribe mamas, is navigating this pandemic and balancing work while you are parenting. More specifically, now that school has started, trying to juggle work, your sanity, and essentially attend school with your children. So it's happening to the best of us. We're all going through it, but I think we're all having a bit of a hard time handling our 9 to 5s while ensuring that our kids have everything they need for distance learning, and that we also understand what's happening, with your schools and helping them thrive through this different time and different way of schooling. So those are one of the challenges that we're in, and this pandemic has affected us.
And Amanda, can you piggyback off of that?
For sure. For us, I think I've noticed a couple of different things. One is I feel like there's a bit of a loss of the extended family element, with having grandparents around. My dad is not as willing to come into our house as he was before, with the pandemic and me having kids. And then also the virtual schooling has definitely been a thing, but for me, someone who has teenagers are not necessarily meant to be with their mom and dad like 24/7. They need that interaction with other teenagers and time to be together with other kids, and finding ways to balance that with health and safety and, thinking about their mental health has definitely been a challenge for us. I think all parents, as it kids, older kids.
Yeah, I mean, we're all charting new territory here, parents, students, families, everyone. Meredith, can you speak to being an expectant mom, a mom and a former teacher, kind of what you're hearing about the challenges and changes for families during this time?
Right. I think we're having families trying to navigate, one, the social distancing, but then also trying to navigate care. So we know that for parents, you have to be hyper vigilant when you're going to doctor's visits. We know, especially for communities of color, and we know for Black women who are especially vulnerable for pregnancy-related deaths, we know they're 2 to 3 times more likely, to die from these deaths. And so you have to make sure that these communities are not falling through the cracks. And so being an expectant mom in this time, making sure that I'm staying on top of my visits, that I'm asking all the additional questions because of the pandemic, because of the severity of care during this time. And so I think right now we're facing that duality that parents are facing, trying to social distance and trying to make sure they're caring for their kids, but then also making sure that they're providing the best care for their unborn child.
Absolutely. Dr. Lazarev, this is perfect for you to come in because part of your expertise is studying and learning and kind of solving these disparities in health between different groups. So what are you hearing from families that you're coming in contact with?
Sure. Yeah. I mean, unfortunately, a lot of these stressors are not new and they're multifaceted, both economic and social. Food and housing insecurity, underemployment, and, unfortunately, for communities of color, the impact of structural racism really, it's been weighing heavily on folks for a long time. And when you add this social and political turmoil, add in economic hardships, and don't forget, by the way, COVID is disproportionately affecting communities of color. It's just a lot to deal with for families, for kids. People are just tired. And so, we are seeing an increasing number of families reaching out to us, being more open to mental health visits and other ancillary services we do provide. And we've been seeing more families opting for telemedicine visits. We know a lot of people are a little bit antsy about coming in, even though we do a great job making it safe. People are kind of falling behind on their routine well child visits and on immunizations. So quick plug, make sure, don't skip those well child visits, make sure that shots are up to date, and that includes a flu shot. But really, just knowing that a lot of these things that are in the spotlight now have been going on for years, and we've been working behind the scenes all along to try and help.
And Karen, I want to talk to you because there's this kind of a sandwich care going on where a lot of people now are taking care of their parents and their kids. How are families dealing with this during these times, and what are you hearing?
So what family caregivers are reporting right now is actually what the panelists have been alluding to already. COVID has really amplified a lot of the challenges that they're already facing. There are more than 11 million Americans, and that's more than a quarter of all of the 50 million American caregivers who are caring for an adult family member who has a health need or disability, while also caring for children at home. So while their children are unable to attend school in the traditional sense, and these parents are unable to rely on the child care that they would normally have, many of them are also unable to rely on the care that they would normally have to care for others in their families, adults such as aging parents. And so they're struggling to juggle it all while also working, and also make sure that every member of their family, from the youngest to the oldest generations, has the supports that they need and access to the care that they need.
And Dr. Morris Hughes, I do want to point out that you all were able to launch the Office of Paid Family Leave and maintain this July 1, which is smack dab in the middle of the pandemic. People have lost their jobs. The economy has struggled. People are on unemployment. This is life-changing for families, and I'm hoping that it doesn't have future long-term, long-lasting impacts. But what is it that you're hearing?
Yep, so what we're hearing is that benefits like paid family leave is more important today than it has ever been. And really what we're doing at the DC Department of Employment Services is offering a lifeline to those that need time to care for themselves or loved one without having to lose income. And so we know, just like you need to be physically present, you need to be mentally present and available, but we also need an economic benefit that's going to be able to tide us over while we're out And what we're trying to do is make sure that we get funding and benefits in the hands of DC workers that need it to care for their loved ones. So what we're doing is super critical, and I'm hopeful that this benefit will be used by all DC residents, and they'll see value in having paid family leave.
Absolutely. Okay, so I want to just talk about the fact that we're all in unprecedented times right now, working from home. This is not a studio, this is a home studio, and kids starting virtual learning. So Meredith, I want to ask you, what would your advice be for families as they navigate these times, like you said, working from home, maintaining their own 9 to 5, and kind of being a tutor, a teacher, a mentor to their kids who are maybe across the hall on their computer in the living room?
Right, right. So like you said, it's really challenging times. So I think it's important for employees to be upfront with their employers and let them know that you can expect the same level of productivity as you did in the past. It's just not possible trying to maintain that duality. And so I think level setting up front, you know, I'm a parent first before I'm a researcher. And I'm thankful to work for an organization that understands that. And so being upfront has been important for me. But then also thinking about creating an open dialogue with teachers and administrators about what resources that you need, and also just about their ability to be engaged. You know, everybody can't have that same level of engagement, and if you're not, being upfront with the teachers about what resources you need. But I think also reaching out to nonprofits. So for example, DC PAVE, they have a website that has abundance of resources on digital learning. You know, UNCF, we've been trying to listen to families to see, you know, what are some of the needs in the community. So also reaching out to those external resources that provide that additional guidance. And then for me, you know, working, and for other parents that are able to work from home, just carving out that time during the day. You know, you don't have to have a color-coded system, minute by minute. I think it's important that parents, you know, also be kind to themselves. You know, we are navigating a pandemic, and so while it's important to make sure you're engaged in your child's learning, which, you know, with working with my toddler, I've seen, you know, tremendous gains with her in terms of just her learning. But some days are not good days, and you know, I understand that. And so not being too hard on myself and letting myself know that it's okay, that every day is not going to be perfect. But we know that parents are resilient. Many are stepping up and being innovative and creating, you know, classrooms and environments that are helpful to students. But, you know, if you're not able to create that perfect classroom with the letters and, you know, periodic tables, you know, don't be too hard on yourself. You know, we're doing the best that we can.
Yes, teachers are teachers for a reason. They are very special people, and the rest of us just have to give ourselves grace to get through this. So Simona and Amanda, I want you all to piggyback off of that, but also I know that you both have a huge tribe of moms, and I'm very curious to know, when people are planning their families, how much of that family planning involves the financial aspect, and are people really considering what happens when they take maternity leave and they only get a portion of their pay, or they only get X number of weeks off? Are people considering this?
Yeah, I could jump in. Well, first of all, you know, great answer, Dr. Anderson, because I think grace is the word of the year. We've all been through it since March when life changed. So today was definitely a day for me with distance learning where I had to remind myself where grace is necessary for teachers and for us and for our children too, because just as we understand we have bad days, I know sometimes it's a little easy to just kind of create a schedule for them and only focus on you as the mom having a bad day, but it's a good reminder that they too are having bad days. So we need to be in step with them. But absolutely, to your question, I think with one thing that we've, I guess, kind of fear or have learned this year is how uncertain life can be. So that conversation is going to start changing if it hasn't already. And I have seen conversations like that amongst our DMV mom tribe with family planning. Like, you know, what does that look like when if this distance learning continues and you can't afford a pod. You know, usually people are thinking the first things, you know, do I have my stroller? Do I have my whatever you need for your baby shower? But now this year has taught us to kind of think beyond that. We were never expecting a pandemic, but now you're thinking about other things. You know, do I have options like paid family leave, so that if anything is to happen, if I am to have a baby, I can get that. I can take time off work without being stressed or without thinking I will lose my job or not be compensated for my time, you know. I think Dr. Hughes said it best, you know, it's not just being physically present with your child, because you can sit next to your new baby or sit next to your teen or your toddler, but also being mentally there in order for moms to thrive. So I think paid family leave, that option is absolutely necessary and is a conversation that is coming on board now amongst parents, because you have to consider way more than the typical, I'm just going to take some time off and take care of my baby. But you're thinking, well, do I need a support system? Do I have enough money to pay for that? Like Amanda said, we don't have our extended families, our village, to come in as easily as we did before. So, and we all know DC is a transplant city for many of us. So a lot of us who aren't from here, our moms can't come from Jersey, California. We got to figure that out. So I think there's absolutely the conversation happening, because I've also seen it myself. I can imagine being in a certain time what that would look like.
Yeah, and Amanda, we know daycare is not cheap, and there's some kids only add expense. You're not saving any money after you have a baby. So what are you hearing from the moms that you interact with?
Yeah, for sure. I think, like Simona mentioned, there's just so many uncertainties that people are being faced with now, and the idea that we can even begin to plan for them is really, I think people are feeling that really it's very daunting to think about bringing a new life into the world, or even trying to care for the ones that you have already into the future, really predicting what type of things they're going to be facing, because I think we can all agree nobody celebrated 2020 thinking that we were all going to become teachers this year to our kids at home. So I think parents are, the people that I've talked to are very concerned about the opportunities that are coming up for them in terms of employment, work at home opportunities, the ability to be able to, like Dr. Anderson said, have an employer situation that is understanding of the type of care that you are going to have to give, and really understanding that I'm a mom first, and then I am all of these 150,000 other things that I am at the same time. So I don't think that people really could plan for something like this before, but now being faced with all these things, there's a lot of overwhelm, I think, in every parent, and what kind of things they should be planning for, what kind of things they could possibly be facing, and even what we're going to be doing as early as tomorrow. So.
Yeah, absolutely. A lot to think about. Dr. Lazarev, I know when I had my baby, I said to myself, I'm taking 12 weeks. It's the max I can take. I did not get paid for all of those weeks. I only got a portion of my salary for the majority of it, but it was just very important for me to be at home, my first kid, to have that experience and to bond with her. And so I'm very curious to know for you, how important that safety net is, the paid family leave, in terms of being able to bond with your child. And oftentimes dads are not part of this conversation. So how key is it for moms and dads, or moms and other partners, or dads and other partners, to bond with their children and have this time knowing that financially they can make it through?
Yeah, I mean, it's so incredibly important. I was in the same situation years ago. My kids are, 11 and 14, but, my leave was mostly unpaid, vacation if I had some left. And so but I had the means to sort of weather that. Bonding is very dependent on the older person doing the bonding. So, I'm a firm believer of happy parent, happy child, but most of us tend to take care of everyone else before ourselves. And so self-care is really important, but that's difficult with social and economic stressors. And so, once those basic needs are met in the form of, partly in the form of paid family leave, it bonding becomes much more meaningful, and it's easier to do when you don't have that excess worry. We only have a certain amount of bandwidth, and if we're worrying about, if we're not going to have enough money or food to last the month, it's very hard to sort of live in the moment and be, mindful and it's also difficult to get enough sleep. Getting enough sleep is one of the most important things, because it's hard to bond with a new child when you are running on fumes, and that chronic sleep deprivation, which a lot of it's unavoidable as a new parent, it really affects our physical, our mental health, our immune system, how we interact with others, including our new baby. And so this safety net is incredibly important. And like you said, it's not just for moms, it's for all parents and all partners. We know that things like postpartum depression can happen in partners that were not pregnant. And so that's something that having that extra time, and we've had that family medical leave, 12 weeks time, but having the extra financial support really lets us focus on what we want to be focusing on, which is ourselves and our new babies.
And is this the conversation that you're having with moms as they come into your office with their babies? Like, I encourage you to take this time, et cetera.
Yeah, I mean, it was hard before this summer when this paid family leave became a real thing. It was hard because people had to go back to work at 2 weeks after giving birth because they just didn't have the resources not to. And this is all, now during the pandemic, they're worried about having, exposing their child potentially to COVID, working in essential roles. And so, I do have this conversation, which is mostly, do what you can and give yourself a break, because the worst thing you can do is think you're not doing it right, and that makes you feel worse. And so really just do the best you can and move forward. That's the best thing you can do for yourself and your baby. If that means that you can't take off, coming up with some ways that you can feel good about what you are doing for yourself and your child.
And Dr. Morris-Hughes, it just breaks my heart to hear that someone has to consider going back to work 2 weeks after giving birth. I mean, A, your own body is still healing, and then B, I just remember how small and delicate I felt my daughter was at 2 weeks. So I could not imagine having to leave her, and I don't have family nearby, so it would be leaving her with someone I've just met. So really, this is a very important safety net for families to consider when they're doing family planning.
Absolutely. And the District of Columbia is really fortunate to have a series of not only programs, but benefits available. I say this all the time, but I'm really fortunate to work for a mayor that is a mom that really understands the plights of moms and women. And so paid family leave is just one spoke in the wheel of maternal health. And one of the greatest benefits of paid family leave is taking away a little bit of the worries that exist as it relates to having an economic benefit or a financial benefit come in while you're caring for your child. I meet not just moms, but I meet dads, and I've even met grandparents that are utilizing paid family leave benefits to support their family. And this is really a family-centered approach. Yes, we often talk just about moms, and we should, because moms are very important. But there are other caregivers that can utilize the paid family leave benefit to care for and bond with a new child, with an adopted child, that we encourage everyone to use this benefit to support the health of their family.
Now, Dr. Morris-Hughes, I know that you advocate for this, and I'm sure you've talked to a lot of business owners, and oftentimes there is pushback from businesses and business owners who necessarily don't feel like this is as important when it relates to their bottom line. What is your response to that?
My response is that a healthy, content, and productive employee is a way that we are advancing not only the workforce, but the business's bottom line. I also explain to people when it comes to mothers, moms have some of the most amazing skill sets that I feel like can't really be taught in school or a certification program. I can multitask. I can hear probably at least 5 different conversations around me. I'm caring, but I could be very warm, strict. I am productive. I'm always focused on the bottom line. And what I want business owners to understand is that not just moms, but parents bring that sort of diversity skill set to their workforce. And we should encourage those sorts of skills in our workforce. And by doing that and having a paid family leave benefit program, not just with the city, but with the business itself, it's okay for businesses to have their own paid family leave benefit on top of what the city offers. I think if they can, they will have a supportive and productive workforce, and that's what we need.
Yeah, and I would be much more productive if I'm not concerned about my 3-week-old at home, and I know
that's right.
Things are taken care of. So Karen, I do not want to leave you out of this conversation at all, because again, I think that we're at a time now where we're seeing this generation, the younger generation, they're waiting later to have families, which means their parents are getting older and they're kind of in the middle of taking care of parents, taking care of kids. So I could only imagine how overwhelming it might be if you are taking care of a parent with a serious health issue and you have a newborn. So how stressful could this be? And what do you say to people to encourage them to get through this?
Well, when we look at family caregivers who are sandwiched between these 2 generations, just to give you some quick statistics on this, on average, they're spending 22 hours per week caring for their loved one. This is in addition to their job. This is in addition to raising their children. So unfortunately, they often lack workplace benefits while they're doing so. And as a result, they end up missing work. They have to cut down on their hours during their prime working years and their prime years for long-term savings. So what we can say to them is to look for those workplace benefits where they are available and to encourage your employers and your policymakers to adopt those. We often think about paid benefits such as paid leave benefiting families at the beginning of life, but really the roles that the panelists so eloquently described, they often play out for loved ones in their later years and at end of life. So having that financial security in order to be there to help your family in later years and end of life is just as important. And in addition to paid leave for new parents and family caregivers, workplace flexibilities that enable caregivers who are raising their children as well as taking care of older loved ones really helps them to stay in the workforce, and that's a return on investment for employers. It helps retain the talent that you already have, and as was also so eloquently pointed out, that caregiving experience, whether it's for your child or whether it's for an older adult, you bring so many skills back to every aspect of your life, the types of management skills that you cultivate to that. I can't speak enough about that.
Totally agree. Now, you're part of a national alliance, so I'm just very curious to know, nationally, how do you think we're doing in terms of taking people seriously and supporting them financially when they do have these issues going on in the home, be it taking care of someone older and or taking care of a young child?
Well, we have so much further to go, and one of the upticks, if I can even use that term in this context, of the pandemic is that it has removed the curtain. It's revealed what families are going through, and we have a common language that we can talk about our experiences from those who are caring for their children in the sandwich generation and outside of that generation caring for older adults without even necessarily also raising children at the same time. We're beginning to recognize the impact that the care that we provide our loved ones, that value that it has on society as a whole. The amount, if you assigned a dollar amount to the value of what caregivers across the lifespan provide for their families, it's hundreds of millions of dollars. So paying these to use the word in the same context, paying these caregivers to actually do this extra job is not just a benefit for families, but also for society in general.
And so I want to piggyback off of what you said, Karen. You said we have a long way to go. So Simona, I want to ask you, in terms of having this long way to go and your experience in talking to your mom tribe, what would you like to see from the country, maybe on a federal level, a state level, a local level?
I think I guess maybe kind of marrying my career to publicist as a publicist, I think more awareness would be great too, because a lot of these programs exist or recently launched, and I think educating our moms across the nation about what exactly these programs are about and what the steps are. So I think beyond launching programs like DC Paid Family Leave and others, I think there needs to be more partnerships with community organizations to educate their own members or tribe members or audience, so that people are actually clear about if they do qualify or if they are eligible, so that not only are they equipped, but they can also share with their families. I think a lot of it is lack of awareness or lack of clear understanding. I think also not only just doing the work of publicizing and promoting to educate these groups, but I think just in general, the partnerships with community organizations, whether small or big, will really empower their moms to ask the right questions before they're in the position where they need to ask the questions. So when they are interviewing with a new job, maybe these are some of the things to ask your employer, how they like how many people there are parents. You know, I know when I had my first son, Sebastian, I was the youngest in the company, but also the only person who'd had a child, except the senior VP, and she was a senior VP, so we weren't on the same level. So no one could necessarily understand what I needed, and the fact that I couldn't, work a press tour all day. I had a baby at home. I also wasn't quite educated on the process of the benefits that I took. So I ended up, I took 12 weeks, but I wasn't paid for the entire 12 weeks. And I didn't get a clear understanding until it was my 6th week and I was waiting for my check. And then I was explained to what was happening. So by the grace of God, we made it. But that was because, my husband was able to say I had resources, but there are so many other women who are not fortunate to have that, and they lose beyond the moment of the joy of new parenting. But your mental health is important, because then it does affect how you in turn treat your child, treat your family, and maybe even treat yourself. Also, that is why there's a lot of physical illness beyond just dying during childbirth. There are a lot of issues that come after childbirth, and that's because a lot of women may not have enough time to properly take care of their bodies while they're taking care of a baby and also going to work. So there's a lot of issues that come beyond preparing to deliver and get care right when you're having the baby. But I think Karen mentioned it, these opportunities are also great for later in life. But the most important thing is, when we're done with the work of launching these programs, the next step is consistently educating and finding the different ways that we can educate all parents and all moms and also employers to ensure that we are all on the same page. I think getting on the same page is what's important here.
And that is why you, ma'am, are a publicist. I totally agree. Now, Dr. Lazarev, I noticed you were nodding along with Simona when she was talking about the financial stress, and then, of course, the physical stress of having a baby. And she mentioned, and this is really when you were passionately nodding your head, she said, this is why a lot of women are dying in childbirth, because they're not taking care of themselves beforehand, and you have all of these stressors leading up to it and after as well. So what changes would you like to see in terms of making sure women, men, families are supported during this time?
Well, I think, I mean, I totally agree. You know, the fact that, you know, especially in DC, the maternal and infant mortality and morbidity rate is so much higher for women of color. I mean, it's a major problem. And I think a lot of that is the added stress, and some of it may be just the lack of resources for a lot of our families, at least the ones that I see. And so, you know, one of the biggest things is making it the new normal. We're the only industrialized nation where it's not normal to take parental leave, and that it's even, you know, even in medicine, in you know, technology, you know, it's not something that's normalized. There are people still get dinged for it a little bit, whether it's spoken or not. And so really just making it the new normal so that, you know, and I see the younger generations, you know, I'm not a millennial, but I work with a lot of them, and they're really taking a strong stance on this, saying this is important. And I think that that's where we're going to see change, because it really is. People just don't have the ability to take good care of their bodies and themselves. And really, I'm stressing themselves, because you cannot take care of another human being if you really aren't able to take care of yourself. So, yeah.
And so, Amanda, I also want to ask you, what would you like to see change in terms of getting people on board with taking paid family leave? And I know sometimes people might feel a little bad, like, oh, I'm going to take 3 months from work. I don't want to put my employer in a bind. But what mentally needs to change for us to not feel these things, especially as women?
Yeah, I think piggybacking on what Dr. Lazaroff said is just normalizing this idea that this is something that we all do. We want to be able to raise healthy children. We can't raise healthy children if we can't have ourselves be healthy as well. And part of that is being able to guilt-free, without any sort of you know, fear of reprisal or fear of being, you know, held down for being a woman who is also a mother, to just be able to take that time that we need to stay home and raise our children at that point. And I think also just to bring in the male partners as well, because I feel like, at least with our experience, you know, with my first son, I remember my husband's work didn't even know that we were having a baby until like the week before I had that baby. So I was like, wait, you didn't tell him that we're having a kid? He's like, oh, it never came up. I mean, well, lucky you. That's a privilege you have, that like I was 70 pounds heavier than I was before. There was no hiding it over here. And, you know, my life had to change and his didn't in such a way. And he was expected to come back to work, you know, sure, miss a couple of days while she's in the hospital or whatever, but you should really be right back here after that. And that whole idea that this is a thing that you're going to do pretty much by yourself, and here's your new baby that you've never taken care of a baby before, and your spouse or partner, whoever, is expected to just leave and go back and not really have to worry about that. His productivity should remain the same, and I should be at home, I guess, struggling to survive on a day-to-day basis to take care of this baby. So I think really changing that whole mentality that this is a family unit and we're doing this together, you know, like I'm pregnant, but sort of maybe we are pregnant too. I'm doing the hard work, let's not forget, but you know, he has a role as well. And I think finding ways to support that and support me as a mother without having to worry about what people are thinking because I decided to take a break. Like, I shouldn't have to take a break from my career. I'm raising my baby. I'm coming back to my career. This is a seamless process that it should be a seamless process that we are able to experience if we have the right support.
Absolutely. It is our baby, and at 1
Right.
a.m. our baby is crying. So get up and go get our baby. Meredith,
Exactly.
I want to ask you, you know, you do research with United Negro College Fund. I'm sure you have a lot of interaction with corporate businesses and corporate leaders. What is the changes that you would like to see in terms of dealing with these corporations? You know, they're so efficient and they're all about the bottom line. But yeah, we need to have families. We need to have our children. We need to take care of them. So what changes do you want to see coming from kind of that aspect?
Well, I would say, especially, you know, during this time, is making sure that employers really just trust their workers. You know, when there's that level of trust to know that, you know, one, you can work non-traditional hours. We know that parents and caregivers often have to work non-traditional hours in this setting. And so just making sure that they allow for that. But then also thinking about flex schedules. So things like, you know, maybe you're off on a Friday or so to be able to take care of business for the family. And that's a huge help for families. And so being understanding of those non-traditional hours. But then also it's even small things like, you know, we're constantly now in this situation, we're on Zoom calls, and, you know, there's often this expectation that you have to have this space time. And that's just not always possible for parents in this situation. You know, like Dr. Hughes said, you know, we're multitaskers. And so I might be fixing lunch for my toddler, but I'm also on a meeting, and I'm also trying to make sure she's working on her ABCs. And so, you know, making sure that that expectation has to be lax, and that, you know, making no apologies. You know, I make no apologies for being a mom and for hearing my daughter in the background occasionally because it's the situation that we're in. And so I think that organizations, corporations need to, you know, really be understanding and not having that bias that comes along, that parents need to be able to navigate the situation in the best way that they can.
Yeah, Karen, I'm very curious, and I want to hear from you. Do you ever hear from people that you work with that, you know, when they go to their employer and say, hey, my mom, my dad, really sick, I need time off to take care of them. Do they ever get pushback, or is it not taken as seriously maybe as someone who says, I'm pregnant, I'm having a baby, it's due this date?
Yes, unfortunately, that is the experience of a lot of family caregivers. And in fact, it's also the case that a lot of family caregivers don't like to disclose that they're family caregivers because they're afraid that that's the reaction that they're going to get. They're afraid that their colleagues are not going to trust them to be able to be there when there's a big project or a deadline, even though they have been there when there's a deadline. They have consistently gotten work done, even though no one knew that they were family caregivers. So it's a very unfortunate circumstance that whether you're a new parent or someone who's been caring for a loved one for a while or just newly caring for them, that there's this assumption that you can't juggle both roles. We have a collaborative of caregiving advocates that we work with across the country, and some of them are actually employers, and they commented that caregivers, hopefully we're moving towards a day where more caregivers feel comfortable that they can disclose their status, and that more employers will begin to understand and appreciate that status, because if you look at who's in the C-suite, many of them are now becoming caregivers themselves, and they can begin to empathize and understand what the role entails and how it actually does help build resilience, and how dedicated these people are not only to their families but also their workplaces. And that's a very tall order. We have so many challenges, and to have people who are so committed to give 100% to both offices, so to speak, the one at home and the one in the traditional workplace. So hopefully we will continue to see a trend where more people will, or we'll begin to see a trend where more people will be willing to disclose their status, because it will be something that's appreciated.
So then what changes would you like to see in terms of making sure that people are respected when they say, you know what, look, I have to take this time off. I have paid my dues at this company. I need this time off. So what changes would you like to see?
Well, caregivers need to be, family caregivers and parents alike, need to be assured that they will have job protection. So we're talking about paid family leave, for both parents and family caregivers. In addition to that, caregivers need to know that they will not be discriminated against based on their status. They need to know that those policies that are in place, that may be in place for them, things like family medical leave, that those policies will be refined to help better address their circumstances.
All right, so Dr. Morris Hughes, you are what I call a turnaround artist. You get in there, you turn things around, and you improve them and make them better. And you really have been an advocate for this paid family leave for quite some time. I do want to ask you, though, things can always be improved. What improvements and changes would you like to see?
Yeah, certainly. I think an area that we have started to embark on that we will certainly get better at is communicating the importance of paid family leave, really going forward with campaigns that demonstrate the importance connect paid family leave in a way that is clearly visible to maternal health, talk about the importance of paid family leave, not just for moms, but for dads and other caregivers. And then most importantly, communicating through a campaign of some sort, taking the stigma out of caregiving. We want people to be able to come forward, just like Ms. Marshall said, come forward and talk about the importance of caregiving, that they are a caregiver, and that there is nothing wrong with saying that you are a caregiver. We want people to walk and own in that truth, and businesses to be able to support and understand that. And I think we will continue to find ways to articulate and communicate that.
Awesome. So I do have to wrap this up. We have about 4 minutes left. And in that time, I want each of you to think of the best advice that you would give for families, be it parents or caregivers or people in that sandwich generation who are both parents and caregivers to their parents. The best advice that you would give them to get through these times and to thrive in these times. And I'll just start by saying, I think you have to give yourself a lot of grace. Reach out to your mom friends, your dad friends, people who have been there before you. I mean, I'm constantly in group chats talking to people, asking, what about this? What about that? What's your advice here? What's your advice there? And then for me, you know, my husband is a financial guy, so he's very good at planning and budgeting. I was kind of caught up in, yay, I'm having a baby and the baby registry and oh, so much fun. But you need that person to take that time to say, this is what our budget looks like for the next 3 months, 6 months, and really a year, because those expenses pop up that you're not even really counting on. And then also to expect the unexpected. And when the unexpected happens, roll with it, because this too shall pass. So that would be my advice. Simona, let's start with you, your advice for families as they get through these times.
I would just say that be non-negotiable about your boundaries. You know, this is definitely a different time. So be non-negotiable even with your own children and husband and your family. So if you need a moment, being able to say that to your friends, to your family, to your employer, to your children, and just, you know, identifying what is priority. Whatever may be priority may not be priority every day, but whatever is priority for that day, decide on that and then determine what the boundaries are for the day.
Amanda.
I would say giving your children that same grace that you are giving yourself. They are also going through a lot of changes, and things are not the way that they anticipated they would be. They are together a lot if you're like me and you have several children. So giving them the opportunity to sort of grow into this, I don't want to say new normal because I hope it's not going to be this way forever, but for them to grow into what they're experiencing now and sort of grow alongside you and the changes that you're experiencing as well. So sort of just being understanding of them and the things that they're going through also.
Yeah, Meredith, how about you?
I would say for parents and families, just don't be ashamed to speak up for the needs of your family, and be unapologetic in that and not feeling guilty. But then also ensuring that you make time for rest. You know, you can't pour from an empty vessel. And I always think about, you know, that yes, there's value in productivity, but there's also critical value in just the blessing of rest. And so I think we undervalue that sometimes, but I think that's critical within this pandemic and just during this time of family care as well.
Dr. Lazarov, your advice for families getting through 2020, really the whole year.
Take a deep breath is the first one, take many, but really, you know, practice self-compassion, prioritize self-care and sleep, ask for help, but always, always, always remember parenting and being a human is an imperfect thing. Nobody is a perfect parent, not even pediatricians, and you need to know that and remember that your neighborhood friendly pediatrician does not always have their stuff together, and that's okay. And that's a good learning experience for kids. They need to see parents not be perfect. It's a great thing to learn, and that's, you know, that's where I stand.
Karen, how about you for those who are managing, taking care of family, kids, etc.?
Advocate for yourself as rigorously as you would advocate for your family members, because you're an important and vital part of healthcare teams. And if you aren't able to keep the ship going for yourself, then the rest of the team won't be able to stay afloat. And that means taking advantage of whatever supports are available, not only for your loved ones, but also for yourself. Fortunately, there are a lot of virtual support groups and other types of assistance that are available. So the fact that we're social distancing is no excuse. Be sure to look for supports where they're available.
And lastly, Dr. Morris-Hughes, what would you say for families to do, advice that you would give to get through these times?
So I would recommend finding an anchor of peace or joy in your day. And so I have some very crazy, busy, long days, but it's something about the hug of my daughter that as soon as I get home and I feel like I can't take another step, I'm exhausted. Something about that hug that gives me a little peace and joy. So find an anchor of peace and joy in your day. The second thing is, and this is a plug for the District of Columbia government, we have so many resources and programs out there. I encourage everyone to visit recovery.dc.gov to learn about every sort of grant program or food program or resources for children and family that are out there. And then also visit the DOES website to learn more about paid family leave. Take advantage of paid family leave. It is here for you. Thank you.
Well, ladies, thank you so much for sharing your time with us this afternoon, your expertise. It's been an absolute pleasure speaking with all of you. You're so accomplished, and I can appreciate that. So thank you for your time, for fitting us into your schedule today. I know it's been very busy for all of you. So to learn more and to stay connected to the DC Family Office of Paid Family Leave, go to their website, dcpaidfamilyleave.dc.gov. You'll be able to find all the information you need there about paid family leave and the benefits as well as upcoming events. So please follow the Department of Employment Services on Twitter. That is DOES_DC. Thank you all for joining us, and you all have a great rest of your afternoon.